Hello, my name is Sultana Afdal, CEO of WISH, the World Innovation Summit for Health. And on behalf of WISH, I would like to welcome you to this special broadcast from the studios of Northwestern University in Qatar. As many of you know, WISH was created by Her Highness Sheikha Moza bint Nasser with the vision of bringing together global experts to tackle the world's most pressing healthcare challenges. Never has that mission seemed so relevant. The discussion today is titled Coronavirus, the Interplay of Medical and Islamic Ethics. And shortly, you'll be hearing from an expert panel drawn from the worlds of medicine, Islamic ethics, and government. We are very grateful that they have agreed to join us here today to share their valuable knowledge. This broadcast takes place during exceptional times. Originally, we had planned to hold this event in an auditorium, in front of an audience. But the evolving nature of the current COVID-19 pandemic has led us to adapt our plans in a way that is mindful of the need to avoid public gatherings. Instead of a studio audience, our audience today joins us via YouTube, and we encourage those of you watching online to interact with us on Twitter via #CoronaEthics. My organization, WISH, is fortunate to be one of many initiatives of Qatar Foundation. As a result, we have been able to draw upon the support of other parts of the diverse Qatar Foundation family to hold and promote this online event. In particular, I'd like to thank Hamad bin Khalifa University's College of Islamic Ethics and College of Humanities and Social Sciences, Weill Cornell Medicine Qatar, Northwestern University Qatar, and QF Communications for their generous support. Now, I'd like to hand over to Dr. Mohammed Ghali, Professor of Islam and Biomedical Ethics at Hamad bin Khalifa University, who will introduce us to his fellow panelists and start the discussion.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everybody. It's my pleasure here to be with you in this session and discussion with the prominent guests today. We have Sheikh Dr. Muhammad bin Hamad Al Thani, Director of Public Health from the Ministry of Public Health. Very nice to have you.
Thank you.
And we have here Dr. Layth Abu Raddad, Professor of Infectious Disease Epidemiology. Very happy to have you here from Weill Cornell in Qatar. And we have Dr. Mu'taz Al Khatib, Assistant Professor of Methodology and Moral Philosophy of Ethics in Islam from Hamad bin Khalifa University. And myself, I am Muhammad Ghali, Professor of Islamic Bioethics at Hamad bin Khalifa University. We will start first with an introductory talk. Let's say it like this, with each of the speakers. And after this, we will have an interactive session, having also your questions, which we can receive through the hashtag CoronaEthics online. And you can follow us also on YouTube and live stream via the website of the World Innovative Summit for Health via WISH. So we will start with Sheikh Dr. Muhammad bin Hamad Al Thani. So I give you the floor.
Okay, Bismillah ar-Rahim. Thank you for inviting us at a very important time in this period. And as you know, Corona has been challenging around the world. You know, Corona is coming from a family that always keep the world worried for every decade. It started mainly by SARS in 2001, 2002. And this is called now Corona. This one is SARS-2 and have another name, COVID-19. Corona has been challenging always because it keeps shifting and drifting from its own type of viruses. And the world was always thinking that we are overdue to a pandemic. The world was always being pessimistic, saying we are overdue for a pandemic, and now it is. You know, we can see in like 1918 we have the Spanish flu, and after 100 years we are having the same time some challenging like this in Corona. The Corona people thought it's easy as will stop in China, then it keep growing and going to other countries. And people thought it will be going easy, but it surprised us in Iran and surprised us in Italy. Italy is part of the European Union. It was killing people every day by hundreds now. This gives the alert for the world that they should take care about Corona more. And the world is now working together. The European Union is closing the borders to control the disease. The Arab world, especially the GCC countries, is taking very restrictive draconian measures. And the other countries are waiting and believing that the herd immunity can help them to keep on. The challenge of this disease, it will be, it's not highly deadly, but it's very highly infectious, and it's traveling around the world in fast speed. So God forbid till it end the storm or this event, it will kill thousands and hopefully not more 100,000. So we are looking forward here to give awareness for everyone in the internet to take care about themselves and their families, to assure they protect themselves. And the people say, I would take care about my kids. I tell them, best you need to take care about your father and your family, elderly, and the people with vulnerable diseases that can be hurted. The challenge now around the world is to assure people to get the right awareness, because the chaos is behind the door. God forbid it will happen if we don't care about how to plan. Governments now are alert and working hard to assure to lower the mitigation of this disease. Many people asking, is there a treatment for this? Or there is hope. There is some treatments countries are giving, and we have the best hope till now is like Germany having thousands of cases with number of deaths is less than 0.2, around 0.2, 0.2 per 100%, which is very low, make it lower than seasonal influenza somehow. But not every country have these facilities or the strength to go around and to aware other people. We are hoping here in Qatar that all the countries are aware, and we are preparing the government to work steady and firm to assure that people are protected. We are dedicating a lot of our time, rules and conditions, and even supporting the public and private sector to assure that they are not affected after the corona economically. All these things making corona now, corona is coming from the crown, the crown, he having the crown, and he's now the king going around the world and making countries feel the fear. We advise here the people mainly to be assured that if they get some protocols, they can help us a lot to lower this disease in every country in the world. And you can be responsible to infect 10, 15%, or you can stop this infection from growing to other people. Other thing about the other treatment, there's a hope. People speak about vaccines started now, but it will take time to start massive production of this vaccine after the trials finish. But we are hoping to lower and slow the increasing of this risky disease by exploitation. It grows very fast all of a sudden, and we are trying to control this through the modeling that we got. Even Dr. Laith has mentioned this in his modeling, and we are assuring that we can protect the country from not spreading the disease as soon as possible. Many countries should do the same and spread this through their government, their society, or their or charity institute.
Just a few follow-up questions, if possible. Yes. Now schools are closed to all online. Universities are closed. Many public services are all online. How long will this continue? People are wondering.
Yeah,
do you have any idea?
Yeah, we don't know exactly, but it's not less than 2 months. Okay. That's 2 months. Maybe till the end of the year. We are hoping something happen, better treatment. The weather helps. People have new tracks, but this can take for months. Yani, it will not finish in 1 month. But the next 2 weeks are very critical to identify to test every country readiness to control the disease.
Thank you so much. Dr. Laith?
Yeah, so coronavirus comes just like what Dr. Hamad was saying. It comes from a family of viruses. This family have been in circulation among humans for a very long time, actually at least 10,000 years. We know now from the common ancestor for the circulating coronaviruses actually has started circulation in humans about 10,000 years ago. It has different viruses, each one which has different effect in humans. Some of them are actually very, very mild viruses. In fact, some of the common cold viruses are coronaviruses, but they don't cause really much morbidity or mortality. However, they do, of course, cause the usual cold that we feel. But this is, of course, not serious enough, and they don't require a strong public health response compared to the new virus. The new virus entered human circulation recently. It was originally it was circulating already among bats because the virus has been identified before, but only in bats. Apparently, it entered human circulation through an intermediate host, probably another animal, which was being sold in a market actually of wild animals in China. So this is how actually the incidents that led to this virus being introduced and start circulating. So all of this really pandemic happened because actually of a very one incident, which is unfortunately the story of many infectious diseases. One incident can cause actually a whole pandemic. Now, just want to highlight a few aspects about what we call the epidemiology of the virus, which is how it's transmitted and so on. So one of the key concepts is the reproductive number. Reproductive number is how many infections each infection will cause. So, for example, for the coronavirus we're talking about here, it has been estimated to be 2 to 3. What does this mean? If I am infected with this virus, I'm going to pass it on average to 2 to 3 people. So it's a very, very important concept, which I will actually explain also shortly why it's very, very important for us. So 2 to 3 is actually a very serious reproduction number. So among the respiratory viruses we have, this is actually among the worst. If we compare it, let's say, to seasonal influenza is usually only 1.3. While for this virus is actually around 2.5. So it's way more infectious, and the infection can spread rapidly, and this is why we have such a global pandemic with only actually a few weeks. So this is, of course, a great concern to us. Now, the last time we have encountered a respiratory virus with a reproduction number that high was actually the Spanish flu of 1918. So this is one of the reasons why there is so much concern globally, because we know this virus has a lot of epidemic potential. It can really spread fast. It can affect very large fraction of the human population. Actually, if we don't do anything, if we let the virus just do its business as usual, just like other cold viruses, it will infect about 60% of the population. It's very, very serious, and worrying actually pandemic. Now, of course, this is just an extreme scenario. We know it's not going to happen because, as you have seen around you, the life of every one of us has been disrupted because of this virus. But it's a good disruption because we are trying to actually slow the virus from its transmission. So there is a very, very strong global public health response, locally and internationally, try to fight this epidemic. So this is one of the important concepts about the reproduction number. Now, second is actually how does the virus affect us when we get infected. So fortunately, 80% of people will have very mild or even asymptomatic infection. It's just very similar to a cold infection. Not really much they don't need really to worry much about it. The infection will be cleared in 2 weeks, or so, on average, and that's it. However, 14% of people will have what we call severe infection. Severe infection meaning an infection that will require some medical intervention, may require hospitalization, but it's still, those people will eventually recover. It will may take them few weeks to recover, an average of probably 4 to 5 weeks, but eventually they will recover. Eventually the immune system will overcome the virus and the people will recover. And then we come to the last proportion, which is 6%. Those will have a critical infection. This is a very serious infection because it requires not only medical intervention, it requires actually intensive care units, because those people may actually suffer from even, organ, loss of function and so on. So it's a very, very critical. They require very critical care, and about 49% of those people eventually end up actually dying currently. Now, but clinical care is being improved. So the hope is that these numbers are based on China, by the way. It may not apply to other places. The hope is that with the improvement in clinical care, this could be actually reduced with time. So this is about how does the disease actually affect us. But it doesn't affect us also differentially. Clearly, unfortunately, the most vulnerable of the population are the ones who are most likely to be affected in terms of severe disease, but also in terms of mortality. So the mortality among people who are above 80 is actually over 20%, 21%. So if they will get infected, they will be really heavily affected by the virus. This risk goes down and down as we go down with age. So for people in their mid-age, the risk of death is actually very, very small. For example, people below 50, It's only about 0.2 to 0.4%. So 2 or 4 in 1,000. It's really quite small risk. It's a bit more than the seasonal influenza, which is usually 1 in 1,000. But still, the risk is there, but it's definitely much lower than people with older age. Also, people with with some underlying health problems, they are also more vulnerable to the virus because their body is not being able to manage the virus, so they are more likely actually to die or to have severe disease as a result of this infection. So fortunately now we do have significant. We don't understand everything about the epidemiology of this virus, but we know actually many things now, still, which is really great progress. So one of the things we know is that there are two main modes of transmission. The first mode of transmission is what we call droplet transmission. This is if I sneeze, if I cough, these droplets, very, very small drops of water, go from my mouth and go in the air. Now, fortunately, these droplets are a bit heavy, so they didn't go far. They go only up to 1 meter, usually in distance. So this is why we advise people, please always keep a distance of 1 meter from everyone else, because if they are above 1 meter, they are unlikely to be affected by such actually droplets. So this is the first mode of transmission. The second mode of transmission is what we call fomites, which is basically if the virus is in a surface. For example, if it's somebody had a droplet, used his hand in coughing, put it on a paper, I touch that paper, I can actually contract the virus. This is, however, much less than the first droplet. Most people are getting infected by droplet transmission, not by fomite transmission, not by touching surfaces. But this is why the advice, people really should always try to wash their hands repeatedly, wash their face. So in this way, even if the virus comes to their hand, it will actually be washed away without them getting actually the infection. So in this regard, it's really quite relatively not difficult to try to avoid the virus. First one is keeping always a distance of 1 meter. And second, keep washing in order to reduce the second mode of transmission. Now, this brings me actually back to the reproduction number I started with, which is very, very important. Whenever we have a new infectious disease, we want to know the reproductive number. The reproduction number depends on how many people I contact per day. So on average, it turns out actually people contact about 50 to 100 people per day. Now, the likelihood of transmission in one contact, however, is actually very, very small. In fact, we know now we have the excellent data from China. Let's say if I encounter someone who is infected, the likelihood, even if I am less than 1 meter from this person, if I'm less than 1 meter, it's actually the risk is 1 to 5%. 1 to 5%. So even though I may every day see people who are infected, I still may not actually get infected. But most important here is this contact rate. What we need is really to reduce this contact rate. If people reduce their social circles as much as possible, this will reduce the chances of the virus from moving, and being sustained in the society. So really back to what we really need right now from everyone is reduce your social circle. If you were meeting tens of people per day and wherever you are, now it should be really, really very few and the most essential. And of course, the 1 meter distance and washing, hands and face. Now, we are not advising this also only for people to avoid the infection. We are actually advising this for something even more important, in order to block the transmission chains in the population. If everyone does this, we all will be protected. If only some people will do it, it's not good enough. Now we know actually from mathematical models, if everyone will actually adhere to 60% reduction at least at a minimum in their social circles, and at least 60% reduction in this 1 meter distance, and 60% reduction in washing, actually the virus will eventually die out. The epidemic will disappear in just a matter actually of few weeks. So this really brings me to a very important message here, that this virus is very serious. We have a pandemic, and the responsibility for dealing with it is not really government responsibility only. Governments can do a lot, and they are doing a lot, but it's really a responsibility of every one of us how we can work together to actually try to plug these transmission chains.
Yeah, I just have a couple of questions about what you mentioned. You said that if we let it go without intervention, 60% of the population will be infected.
Correct.
Why not 100%?
This has to do with herd immunity. So what happens usually with these respiratory infections, and actually generally for all infections, so now let's say I am infected, correct? Now everyone in the population is susceptible and can get infected. So I can easily infect 2 to 3 people, correct? Now when actually the 70%, 60 to 70% of the population are already infected, and when 60% of the population are already infected, the likelihood of me passing the infection to somebody susceptible gets reduced by 60%.
Because already infected.
Because they are already infected and recovered. So they actually no longer, even if I pass it to them, it's not going to cause an infection. So this is what's really herd immunity, is that already lots of people would have recovered from the infection, and they will not be affected if it passed to them. So my transmission will be useless because it's not going to go to a susceptible person.
But we don't have groups or specific people who are immune to this?
Currently, only people who already recovered from the virus are immune. In fact, almost certainly all of them are fully immune. We don't know for how long they will be immune. Now we know from other cold viruses, it's usually close to a year. Maybe 40 weeks to 52 weeks, something like this for the other coronaviruses. And even after 40 weeks, they still have some immunity, but it's not perfect immunity. The immunity starts waning, going down and down with time. So, but
there is no natural immunity
No,
for anyone. Anyone can get it.
Right now, there does not appear to be any natural immunity, except maybe for children in China at least. Some of them got affected, but at much less risk than the adult population. Now, it's not clear till now actually why this happened. I mean, some of them got infected, but much less. I mean, I'm talking about more than 90% less. This one possibility, which again remains to be seen, is that children especially are quite prone to getting cold viruses, like coronaviruses. You know, daycare, every one of us, when we had our children in daycare, all the time they keep getting infected. Why? Because they don't have, to begin with, immunity, and they are building their immunity in this young age. So possibly because of exposure to other coronaviruses in recent times, their immune response may have been actually strong enough to actually overcome the new coronavirus.
Okay. Another question about the getting the infection through touching surfaces.
Yeah.
Are all surfaces equally infective? Or some are more infective? So, for instance, glass, metal, other material, the same?
No, actually, there are actually differences depending on each material. Something like stainless steel, for example, it's actually the virus can last for up to 3 days actually over there. So it depends really on the fabric. But also, I would like to really calm people. I mean, people seem to think to worry too much about touching surfaces. What we know is that it's true. The virus can live up to 3 days on a surface in which it was left. However, we are not completely sure whether it's a viable virus. I mean, is it really a virus that can generate an infection? Because maybe there are some defects, it prevents it from really affecting us. The other thing also, even if it stays for 3 days, it gets reduced with time a lot. Usually the worst time is in the first half an hour. Now, once humidity dries up, then it really affects the virus, start breaking the bonds, so it will become less viable for infection.
Okay. The last question before I move to Dr. Al-Khatib. You said that we need to reduce contact. So we have between 50 to 100 per day. So if we can bring this back to less number of people, it means good. What about the duration?
The duration of the contact?
So for instance, we are staying here with 50 people, and we are together for 1 hour. If we make it half an hour, does it reduce?
Of course.
Although we have the same number?
Yes, absolutely.
Okay.
It's really the question of how long is the contact per person. The longer it is, the more the risk is higher. Yeah.
Because this will have moral implications later on. So now, if you don't want to add any points at the moment, I'll come back to you later. Now we move to Dr. Mu'taz Al-Khatib from the Research Center for Islamic Legislation and Ethics at Hamad bin Khalifa University. I give you the word to say your insights also.
Thank you very much, Dr. Ghali. In the past few days, I was following up the news and in English and Arabic, in both. So what I found that the most of the discussions focused on medical questions, because this is normal, because people are very keen to practical issues that related to their actions and movement, especially daily movement. But actually, we rarely dealt, or we hardly can find ethical discussions or discussions on the ethical application of what we are facing now, the coronavirus or epidemics in general. And even some people and governments even underestimated at the beginning the risk of the virus, and this is why we found that the intensive work was very late, and then it looks like emergency case now in over all the world. But even some people went very far because they ideologized the coronavirus based on political aspects or religious aspects to prove or demonstrate some ideas that they are interested in, whether it's niqab or religious belief that they prevent them from getting infected by this virus, or and other political, for example, political interpretation of the virus, because this is a biological war, or was prevented by China or America, against China, or the other way around, So I believe that now people are getting taking this more seriously and more seriously than before, and I think we should address we should not avoid the ethical implications or applications of this epidemic phenomena. But why do we need ethics in this regard? So ethics usually helps us to set the rules or the priorities, to set our priorities, and to then set the right course of action that we should act or respond to this virus or epidemics in general. So, and even behavioral and institutional changes require usually ethical justifications to convince people, first of all, to act this way or that way, and then to do balance between different values. They might contradict each other, to make it more understandable, and give some examples. Like, we can when we talk about medical questions, we know that the key medical questions that our doctors and physicians are interested in, and even general public are interested in, how can we stop this virus, but and what treatment can we use to stop this virus, or such questions. But the applied ethical questions are like, we have many applied ethical questions related to this, including, if I am a doctor or the government, who should be treated first? If we have a huge number of people like Italy, what's happening in Italy and Spain nowadays, So we should find criteria, because, any medical system, any health system is not able to cover all this amount, a huge number of people at the same time. Ethical questions. So to answer this question, for example, we need to set a criteria. How can we behave? You know, and for example, do travel bans harm more than they help or not? And are we late to do travel ban, and why it was not done before, much earlier than nowadays, for example? You know, these are ethical questions to should be answered. You know, and even the research now, which research that should be top priority? You know, nowadays, for the research centers are related to this virus and epidemics in general. Should unaffected nations offer support for hard-hit countries, for example, and what type of this support that can be offered? So we have a lot of questions, ethical questions, can be raised and discussed in when we talk about coronavirus. But I would like to just spotlight on key issues to show how this virus are linked or interacted with ethical discussions. So we can talk about 4 approaches to discuss the ethical aspects of epidemics. First of all, ethics of epidemics in itself. You know, when we talk about isolation, quarantine, how can we justify these? Can we go directly to quarantine before doing the isolation, or you know, and how it should be? What are the moral responsibility of the individuals and the governments, etc. So this is just I'm not going to give more details about this. Maybe in the discussion we can talk about this, or you will address this, I think. So the second approach that can be raised here or mentioned, public health ethics. You know, when we talk about public health ethics, we are talking about, you know, the policy, the health policy that should be made to prevent this virus from spread. To prevent spreading of this virus, should we follow the priority of individual rights, or should we follow the community and the public interest? You know, which one should be prioritized over the other? Nowadays, we know that, you know, what's happening in France, for example, now, and Italy. You know, they are very there were very restricted policies and actions. You know, now people are not even allowed to move outside their home in France without a certificate. It should be done online. You know, so this raises an ethical question about the freedom, which is the basic. Maybe individual people find it like basic human right, but now in this emergency case, the situation is different, and this indicates to the level of the risk that the government aware of, you know, because they have a lot more information than the individual people. So the third approach, it's ethics of emergency preparedness. Ethics of emergency preparedness, it has an exceptional treatment, because, you know, when we talk about emergency, we are talking about something like an ongoing narrative unfolding or drama unfolding. So it needs it's dynamic, and it needs you know, decision making quickly, and you know, quick decision making, and you know, it can changes from, you know, from time to time quickly, even the same day. It depends on the information and the estimation of the specialist people are you know, based on what's happening on the ground. The fourth approach, it's normative and virtue ethics. So This is usually deal with the individual actions. So how it addresses the questions related to the individual characters and actions, how they should behave in this emergency case, you know, and they should know that it's related to the cognition of destiny, the shared destiny, and as Dr. Laith explained, because this is not open for individual choices, because any action from any individual person will affect the others. So here we are not talking about, you know, individual or personal preferences this is why we should talk about relational autonomy, which affects other people. So finally, I hope that I didn't take so much time. So I would like to end up with, you know, key moral principles that govern our actions in epidemics, dealing with in response to epidemics, like for example, you know, if we are talking about priorities, so the criteria, whether the criteria should be, you know, dealing with the sickest people, or we should deal with the most possible survival, you know, cases, or we should deal with young people or the old people first, you know, so we can. There are disagreement about you know, which criteria we should confirm here or rely on to behave based on it. If we are talking about, you know, usually we are talking about set of values in this regard, like the protection of life and health. We are talking about the value of individual liberty and ethical justifications. We are talking about, you know, justice and preparedness. We are talking about, you know, ethical responsibilities towards persons and groups, professional obligations and divided loyalties, etc. So, but we can talk about, you know, isolation and quarantine. When it can be justifiable or not. How can we provide ethical justifications for quarantine? So usually it's ethically justifiable when it's effective in controlling the disease or the epidemic. It's ethically justifiable when we talk about, you know, when it is proportional to the severity of the epidemics. It's ethically justifiable when it is necessary for controlling the epidemics. So it's justifiable, ethically justifiable when it's there is transparent between the government and the public. So to convince them and to let them know how the situation is, and you know, and to take the instructions, the government instructions, seriously. So for the principles of public health, we can talk about 4 principles: solidarity, efficiency, integrity, and dignity. So in the discussion, maybe we can give some more details. Finally, if we are dealing with, you know, liberty limiting practice, so there are 4 key moral principles that govern or values govern liberty limiting practice. These are, you know, preventing harm, proportionality, reciprocity, and transparency. So, and then we will leave some details for the discussion, inshallah.
Thank you so much, Dr. Mu'taz. I would give myself also the opportunity to say a few things as someone who's working in the field of Islamic bioethics. I think that much of the ethical discussions are depending on the medical information. This was the case in the past, and this is still the case in the present. The problem we have in the moral discussions, and specifically in Islam, we have an important and high level of authority given to our pre-modern religious scholars. These pre-modern religious scholars wrote about pandemics under titles like Al-Ta'un, plague, or pandemic, Al-Waba. And they wrote about not only by quoting Quranic verses and prophetic traditions, but also based on their perception, conception, or what we can say now misconception of what pandemic is. So when we quote them today, and this is happening now almost day in, day out, especially on the social media, if we are not aware of the historical context in which how they perceive the medical aspect, we would be in trouble. So we can say in the pre-modern context up to the 20th century, the end of the 19th and the beginning of the 20th century, one of the key aspects of perceiving pandemics or plague in their terminology at this time was the mysterious character of the pandemic, of the plague. We don't know what this is. We don't know what makes it happen, what's behind it. So many of the religious scholars would say that whatever the physicians say about the cause of the plague is based on not what we call now evidence-based discussion. They don't have evidence-based discussion. At this time, they were speaking most of the time, and this was quoting from Greek tradition, about corruption of the air. فساد الهواء. So the corruption of the air is behind it. Religious scholars would say this is not true, because we see cities with the best air quality, and still they have that. Some physicians would say it's contagious, so it will infect other people. They would say no, but this is not true, because we see people in the house, the family. Some would be infected, others would not be infected in the society, etc. So there was a big debate between the physicians and the religious scholars at this time. The mysterious character of the disease was an important point. The contagious character of the disease was an important point. Of course, that it is fatal, it's killing, that it is widespread. It's not for a group of people, but for almost everyone. And there was a moral panic. And it's a time of panic in which people become uncertain about their values and how to prioritize them. I just like to quote one of the scholars who lived a plague and who died because of the plague, who later became one of the victims. This is Safadi, one of the historians. Ibn Aybak Safadi, I think the name. He spoke about the plague in the following, and I'll just say it in Arabic. I will give the translation later. He says, when this pandemic happens, إذا هجم عم البلاد وغم النفوس وأذاب الأكباد وتقدم بعساكر المنايا ودهم بكبائر الرزايا وألقى الرعب في قلوب البرايا وأبقى صدورهم في البلايا وإن دخل بيتا كان آخر أهله خروجا, etc. So he speaks about the moral panic. وألقى الرعب في قلوب البرايا. Everyone is in panic. Everyone is afraid. It's killing. If it gets into a house, it is the last one to leave the house. So everybody dies and leaves the house, and he is the last one. And when we come into the modern time, a great part of the mysterious character of the disease has been sorted out, has been decoded. Especially in 1894, when the plague happened in hit China, and people could decipher what is behind that. Maybe later you can explain to us what happened exactly. But anyhow, they could define why. It's not the corruption of air, but there is a very clear evidence-based information that explains to us what happened. This will have its moral implication on the discussions. The contagious character of the pandemic is now beyond question. As you gave the information, we have statistics, etc. So this should also impact. So the point I want to make, at this point, at this historical juncture, we cannot say, oh, but the religious scholar said, and these are great religious scholars, we cannot go against them and say, but this is not. No, because the medical information is not the same medical information that we have at the moment. Of course, at the end, we remain that pandemic is more or less a continuing phenomenon. Changes the names, but we have pandemics. We had the N1H1, we had many pandemics ending with the corona disease. Ethically speaking, the main ethical dilemma in bioethics in general, including Islamic bioethics, is how to strike good balance between public good and individual good. So for the individual good, we have individuals whose liberties must be respected and must be honored. And we have a public good that also must be honored. When we have a pandemic, it's difficult to keep both. Usually, if we take coronavirus as a public health issue, we usually have 3 phases. In each phase, the individual liberties and individual rights will be compromised and undermined. The first one, we must have a database infrastructure. Like now in the case in Qatar, we need to do surveillance, we need to do screening, we need to do notification. We need to know who is infected with the disease. We record these people. We give their names, possibly also addresses whenever it's necessary, to the public health authorities, etc. This is against the normal value of protecting people's privacy and confidentiality of their information. But in order to preserve the public good, we need to do that. We can restrict the movement of people. Now, many countries, people cannot travel or cannot get into the country or cannot get out of the country, etc. We do screening in the airports, which can be quite disturbing for the people, causes delays, etc. But for this phase, it seems, for the bioethicists, it is the least problematic one, collecting information. When we move to the next, social distancing, it becomes more problematic because we are not only collecting information, but we are putting restrictions on the behavior of the people, which would be, originally speaking, not be problematic. So usually in bioethics, we differentiate between isolation, and this is for the infected people, we isolate them, and we have quarantine. Quarantine, not only the infected, but those who came in contact with those people who were infected. So because we may think that they are infected but asymptomatic still, so we need to do them. Here it becomes problematic because we are infringing upon the liberties of the people, upon their autonomy, upon their freedom, upon their authority over their bodies. They need to decide what to happen with their bodies, where they live, etc. The third one is the enforced intervention. When we have, for instance, a vaccine and we say these people must be vaccinated, and they say no, I don't want to be vaccinated, for instance. Or we have a treatment and we have to treat them, not just only for them, but to treat the public. Usually in secular bioethics or Western bioethics, we have utilitarian theory, which is the more dominant one. And usually in the context of public health, especially practical public health, not research, public health, like the case of coronavirus, individual good can be sacrificed for the public good. This is the general rule. Of course, there are so many restrictions for this, but in general, this can be done. In Islam, we have the maslaha concept, the concept of public interest. And we have so many legal maxims that can help us in this regard. I will not get into all these details. Maybe in the discussions we can get into them. But these are the ethical discussions in general, which relate to almost everybody, whether they are believers, non-believers, religious people, Muslim or not Muslim. But there are some aspects in coronavirus which relate to the religious people, those who believe that there is God, including Muslims. One of them is that which has been stressed so much in the classical works in Islam, divine agency. God is the agent, fi'lullahi tabaraka wa ta'ala, in life. And they use this in order to explain why plague would happen. What is this? It's what God decides, more or less. But I think we can use it now also in a positive way to say that don't stigmatize people. Don't confuse between classifying people as vectors, carriers of the virus, and as liable agents. The people, we look at them as more or less criminals. And so this can heavily affect and undermine the dignity of these people, and we don't have a strong moral justification to allow this. So these people can be put in a quarantine, can be isolated, yes, but to move on, to stigmatize them, and to see them as liable, as criminals, no. Why? Because God is the agent. This person who got the virus can be you, me, can be anyone else. So this is one thing. The second thing is not to confuse between divine agency and natural laws. Allah subhanahu wa ta'ala acts in life, but He does not act in life haphazardly. He acts in life through laws which are consistent and can be discovered, can be understood, can be examined, and we can use them for our best interest. So Allah subhanahu wa ta'ala does not make someone sick and the other person healthy just like that. It's because He made laws in life. Some people respect these laws so they are healthy, others not so they become sick. It's that we do something wrong and then we become, our health condition will be compromised. So there is contagion. We cannot use the classical discussions on plague, apply them on our modern discussions to say we can do whatever we want. Like some religious people would see, BBC had a report about this, people who would go to visit the shrines of the holy people according to their perception, and they think these are protected, these are outside the natural laws that God made for everyone. The natural laws that works outside worship places are the same natural laws that work inside the natural places, and I think that the figures coming from science would truly approve this. The other issue in the religious aspects is the moral opportunism. I don't know if this is the right term to use it, like the examples that Dr. Mu'taz mentioned. Because of coronavirus, when we came here, we didn't shake hands to each other because it's a bit risky. Some religious people, some Muslims including, thinks that shaking hands between men and women is religiously problematic. This is haram, or this is something not good from an Islam. And then he would say, look, coronavirus shows that we are right, because now even the men cannot shake hands with each other. Some people think that face covering veil is a religious obligation. Look, now everybody we are using masks and stuff like this. But yes, if we go consistently with this, sitting together is also risky. So can we say that congregational rituals are also not good? So we have to pray at home because of the coronavirus? This is a problem. Jumping from the epidemic disease to take conclusions that will support our opinions is also quite risky. So these are the key points that I prepared. There are some other issues which we can get into the discussions. I received a couple of questions from the public. We also have the results of the polls. People on internet were asked a couple of questions, and they were asked to give their opinion, agree or disagree. It may be good to start with this and to take each of you your feedback about these results. So number one, the moral obligation, this is the proposition, the moral obligation of protecting people's privacy has no place in the context of pandemic diseases. Almost 60%, 52.9% agree it has no place, people's privacy. 47.1% disagree. So almost neck to neck. But anyhow, we have a majority, small majority saying they agree. There is no place for people's privacy. When we have a pandemic, we can collect information, we can put them, isolate them, put them in a quarantine, force them to take vaccination, etc. I think you are in the best position now to give us your feedback about this. Do you think that the government can go that far by compromising people's privacy completely?
Yeah, the situation is escalating. When it's escalating, you need to do more to save more. And this is the moral behind this. Nobody wants to hurt anyone's privacy, but the challenge is that if it needed, you need to do it very simple. You take a kid from his father if he's hitting him. You know, you divorce people from his wife if the wife is abusing her husband, whatever. So there's many reasons you take an action away from the privacy or freedom to save the humanity. Because when you are leading your nation or you're leading the world, you are sure that the life is very valuable and you give every person a chance to live properly. So if some people are stopping others from living properly and growth and prosperity, you need to act. Regarding the question, you said no privacy. When you say no privacy, people are worried. But if you say they can enter your privacy, you'll find 80 maybe % against 20. You said no
maybe
privacy.
That's why
the word no
we don't have more than 50.
Yeah, it's very strong for people. So,
Yes.
no. But you see, some privacy, they will accept it. It's that ما دخل الرفق شيء إلا زانه. We say if anything come in a smooth way, it can be better. And part of our morals, if we prepare early, we need to cross little morals in the end. But if we acted late, it will end you cross many morals to deliver your goal because you acted late. You know, it happened all the time. So we're looking always to be prepared early, aware people, and to be ready for what's happening. Like people are complaining, saying, you isolated me, or you took me in a bus. Fine, you go to Hajj, you go tourism, you know, these things you do it always in the same days, you know, in many days. And this is a small part regarding, you know, what will happen if you don't take these actions to save others. And this action doesn't come from a person who wake up and take the decision. It comes from committees and other committees, many wise people working together to assure that they are choosing the best chance to come to survive. Other question, plague is very risky. You know, in history of Islam, the Islamics, you know, were not caring about their health sometimes, and they say, a lot of belief that Allah choose whatever He wants. But they didn't go for sunnah a'qalha wa tawakkal. They didn't say you should take care about yourself.
Try the camel and then
exactly. Yeah. So many people protected themselves and they were saved. And these people then raised, and their philosophy raised in the world, or even the Islamic world, because the others have been died because they didn't care about their humankind. One of the roles in life I see, any leader should take care about humanity and life. Even people have the right in the religion, but everybody have the right to survive. So if you don't take care, focus only about the structure of the deen without caring about the health of the people and the morals, this is very risky. And this is what happened through the world. Always the leadership call for people who take care more about humanity.
Dr. Laith, do you have comments about this?
I completely agree with Dr. Muhammad. He very nicely really captured it, and it's a very complex issue, and I think the question was quite too extreme. Yeah, I think as a matter of principle, individual liberty, you know, civil rights and privacy should be guaranteed to everyone, you know, with no question. Now, but we are talking about very exceptional circumstances, and these circumstances really, I mean, do not leave us any choice but actually to act. So there will be some violation of privacy, but this violation should not be. I mean, is really comes only after very deliberate thinking. You know, I mean, every decision by governments that are making in invading this privacy is actually come after a lot of discussions, because, of course, nobody wants actually to go that far. So I think this is very, very unusual circumstances. We are talking about an epidemic that, inshallah, will not last for more than few months, you know, and then we'll go back to our normality. So just people will have to accommodate. Now, interesting, however, thought that it still is, I think, a very difficult question I always find. This issue where we stop individual versus actually society, rule. And we see it a lot in our field in vaccine. There are people who strongly, believe against vaccine, but those people are actually endangering the rest of society, because again, we're back to herd immunity. If actually sufficient vaccine, by the way, just like the herd immunity I was talking about earlier, vaccine work exactly this way. So we need a minimum fraction of people in the society to be vaccinated in order for everyone to be protected. If sufficient fraction of people refuse to vaccine, then we will not have that herd immunity, and actually the infection will stay endemic. Yeah, so these are, I think, very, very difficult questions, but really, I think, here, you colleagues, you are definitely the ones we need really to look for answers, because of course religion plays a very important role. Also culture plays even beyond religion. And very, very difficult questions.
Mu'taz, do you have a comment?
I agree with both doctors, and I think when we talk about privacy here, we are not talking about we are talking about in pandemics. We are not talking about individual actions here. We said at the beginning, and based on the information and based on the fact that we in reality that we see every day now, our individual actions are not any more individual, in this context. So any individual action will affect the others that I am living with, or I'm moving, around and being in contact with them. So privacy here is a bit ambiguous and problematic in this context, when we are talking about pandemics. This is number one. Number two, that when we talk about the government's actions regarding privacy, so it's not the governments in general have no full freedom to go against privacy, but it's restricted based on to some specific criteria, like, for example, it should be proportional to the action that Dr. said that it should be based on the need, so it's not full, not respecting privacy in general, but it's it's limited, and it's an exceptional case, which is emergency case here, and it's based on another criteria, which is the benefit that we expect. It should be efficient. The efficiency is very important here. So and it should be at the same time reciprocity. Because reciprocity.
Mutual.
Because I'm going as an individual. I'm going to leave my privacy, but at the same time, you need to, if I will be isolated or quarantined, So at the other side, I have rights. Should be, achieved. So, and then when we talk about privacy here, so we are not talking about giving names and details. So the using of the information are very limited and restricted to the need and the maslaha, the public interest that we need. So this is an anonymous. The names should be anonymous names, and these details should not be mentioned in the newspapers or anywhere in publicly.
If I may add something about this graphic, and also the question from Dr. Laith about vaccination. Globally speaking, global bioethics, we can compromise people's liberties and even to some extent issues related to their human dignity when we have harm. Principle of harm can be a good moral justification. So if they are going to harm others, then we can put restrictions on their freedom. So for instance, if you don't take the vaccination, you are going to put the life of X number of people at risk. And you say, no, but I don't, and I have authority over my body. This can be overruled, even in general, in bioethics in general. Islam would go a bit further, because this has to do about autonomy and people's decision. But in Islam, we have also the lawgiver, a-shari'. And a-shari', Allah subhanahu wa ta'ala, He also prohibited self-inflicted harm. So if this harm will not be for others, but will be for you, but we are certain that it will happen, we can do restrictions on your freedom. So harm is one of the key words, the key principles that can limit people's liberties and can compromise their right for privacy sometimes. Yes. Can we see the next question? Yes. Is it ethical to close international borders to quell the spread of disease? Here it's not that controversial.
Clear question.
So 91, more than 91% agrees and only 8.7 disagrees. Dr. Muhammad?
Yeah, I think this is clear that even in Islam there is hadith الرسول صلى الله عليه وسلم إذا كان قوم فيهم طاعون لا يخرج عليهم أحد ولا يدخل عليهم أحد. يعني it's like isolating different communities is one of the best thing to do in Islam. We have it and it saved a lot of lives. And during Amr ibn al-As, when Abu Ubaidah Jarrah died from the plague, Amr ibn al-As take the idea, go flee in the mountains, go far from each other, and this will protect you. And this is how they survived, and survived a lot of knowledge with their life and the history of Islam during the early age. So blocking this, you are isolating all the country and being responsible, and this will, in the long term, is a proper thing for all the countries to assure that you control the spread of the disease.
Dr. Laith?
Fully agree. I mean,
Yeah.
I think it's clear question.
The same. I think it was too late to close the borders,
Yes.
because if
It's
this
never
was
too
made,
late. It's never too late. It's never too late.
yeah, it's
Yes.
so yeah.
Just to explain the point you referred to, the Dr. Muhammad was referring to the incident of the plague of Amwas, plague which took place in Sham at this time during the caliphate of the second caliph Umar ibn al-Khattab, when he was about to get into the city of Amwas. And then he came to know that there is a plague there, and then there was a discussion: should we get in, should we go back, etc. And at the end, Abdurrahman ibn Auf, one of the companions, said that I heard the hadith from the Prophet ﷺ: when there is a plague in a city and you are in, don't leave, and if you are out, don't get in. I believe this is the incident that you were referring to.
And for the other addition, like when Abu Ubaidah asked Amr al-Khattab, are you running from قضاء الله تفر من قضاء الله؟ قال أفر من قضاء الله إلى قضاء الله.
Yes.
So as believers, we know that Allah not only control an area, but control all the universe.
Yes.
And we are taking actions under His mercifulness and under His destiny. So we have the freedom to choose some proper things that go with our safety qalbak, which go with our feeling what's right for our life or better.
Yes, this is of course summarizing a very complex theological issue in the discussions in Islam about plague. But of course the statement of Umar al-Khattab is quite illuminating when Abu Ubaidah al-Jarrah, when he decided that he will go back to Medina, he will not get into the city hit with plague. So Abu Ubaidah al-Jarrah said, are you fleeing from God's destiny? What God has destined, we will get it. So Umar ibn Khattab said, we flee from God's destiny to God's destiny. So if we went to Medina, we are not fleeing. We are always by the hand of God all the time. But this refers to what I mentioned before, that there is divine agency and there are natural laws. Natural laws, usually they are seen as either or. So you respect the natural laws, so you leave out the theology, or you keep yourself in theology, so you cannot give any role to natural laws. My reading to the incidents that happens, to the writings on this, is that it's not either or in Islam, because we believe also that the natural laws are made by God. And the consistency of the natural laws is an indication of the omnipotence, of the unlimited power of God and His wisdom and His justice. It's not haphazard that things happen without having any laws. And the hadith of the Prophet ﷺ about the disease and the treatment, he used the word ما أنزل And anzala is usually used for the revelation, sending down. So he said that God would never send down a disease without sending down the treatment, and then he gave it to the issue of knowledge and ignorance. Some would know the treatment, some wouldn't know the treatment. So there are natural laws that can be discovered, can be unraveled, uncovered, etc. So this was the second question. Can we go to the next one? During pandemics, countries with scarce resources should prioritize society's most vulnerable over those most likely to cover. This is one of the issues that Dr. Mu'taz raised. So we have scarce resources. Who should be prioritized? The most vulnerable or the most likely to recover? Here, 80% says that the most vulnerable, not the most likely to recover. 80 to 20%. I think this is again is what's happening now in Italy, for instance. In Italy, they are giving it to the most likely to recover, isn't it? So they are excluding the elderly and.
Well, I'm not sure. We cannot accuse them.
Okay. So anyhow, your comments about this. What do you think?
No, it's important as merciful. As in Arabic, say, "La yarham, la yurham." If they take mercy about others, nobody will be mercy about you. And this is where the is responsibility. The system should be capable to take care about everyone, the vulnerable. But the vulnerable, because they know they are vulnerable all their life, they should act properly. You know, if you are sick, you're asthmatic, you're cardiovascular, you're old, you should isolate yourself. Your family should protect you. Okay, so the number of these cases will be less than what we need to treat, so we can handle them as priority and get to the recover, because they can easy to be handled. You need less power. But the challenge in Italy, if you have many vulnerables are waiting, and every vulnerable you can save 6 against him. Here the challenge: one vulnerable takes care about 4 doctors, while these 4 doctors can save another 6. And this is an old, he's 90 years old, or you get 50 or 40, what you prefer. This is challengeable, but I believe nobody would like to be in this situation, but I think Allah, the situation will tell you, to guide you, and if you work hard, you can save both.
Do you have any comments?
It's a very difficult, question to ask. Now, one way to answer it is actually through health metrics. So one of the things we do is to see how many actually, for any interventions, how many actually quality life years have been added as a result of this intervention. Now in the field, there's a whole field which is called health economics, which decides which intervention the government should actually adopt. Is it this intervention or this intervention? So now, and there is even monetary value over there. Let's take, if we take a country like United Kingdom, so they just made a decision, any intervention that that gives one healthy life year, for less than £20,000, they will actually cover it. This is through the National Health Service. However, if the intervention will cost more than £30,000 to actually this increase in life expectancy of 1 year, they would not actually, they are unlikely actually to cover it. So it's a completely different way of thinking it about really any intervention, how many life years will it actually save in the population. This seems to be where in our field we are going, is to base such actually answers, kind of to avoid the moral questions by going to numbers and really deciding based on actually just simple arithmetic. What is the best course of action is the action that saves the most lives, the most life years in this population.
I agree that this is very difficult case to take a decision. But if I would like to stress that all people have the same value of life. So we have to respect this. But if we have to take a decision and to choose between them, so first of all we have to choose healthcare workers, because they are working on the front line, and they, we call it in Islamic jurisprudence al-maslaha al-muta'addiya, because to save these people, to help us to save the others, So we should start with, if there's some. Next, I think we have to start with people with the higher possibility to recover and of surviving.
The most likely to survive.
The most likely of surviving. So because there's a hope, there's a high possibility of efficiency, you know. But going just for choosing young people, you know, and leaving outside the old people, this is not. This is based on utilitarianism, and this is not, in my point of view, it's unethical.
Yeah. Shall we go to the next one? Restrictions on congregational religious gatherings, e.g. Friday prayers, should be less strict than those applied to other collective gatherings such as sporting events and concerts. So should they be less? 65.9% disagree and 34.1% agrees. I think in this I will start with Dr. Mu'taz about Friday prayer. Dr. Mu'taz is an important social media figure in our circles. So he knows the type of discussions, the heated discussions about these issues. Some Muslim countries already closed the doors of the mosques. Others didn't, like here in Qatar. Till the moment that we are talking now, we don't know what will happen.
I think it happened, isn't it?
It happened.
It happened
In
already?
Qatar, it happened,
Okay,
yes.
so it happened before.
There was a decision yesterday.
Oh, yesterday
evening.
Okay.
Yeah. So
what do you think about
yeah,
this?
I think you know what happened is from even Islamic jurisprudence is legitimate and is legal. So and this is the right action that should be done. And this is what happened based on different fatwas in this regard. And my article will be on Al Jazeera Net in coming tomorrow will be on this issue. So to justify and give the ethical justifications and jurisprudential justifications for closing the mosque and reducing the contact between people. And this happened actually, you know. Some people are just arguing against this because, you know, they have, I think, wrong idea about, you know, the obligation. We are not talking about canceling the obligation of Friday, because when we talk about Friday, we have another obligation which is Salatul Dhuhr, you know, Dhuhr prayer. So we are moving from one action to an alternative, you know. So there is no discussion about canceling the obligation here because it's not canceled, you know. This is number one. Number two, that, you know, for in the Islamic jurisprudence there is a justification for leaving Al-Jumu'ah prayer, and anyway, you know, doing Al-Jumu'ah prayer is not a religious obligation to do it in the mosque, you know. Mm-hmm. Nobody said that, you know, it should be done in the mosque. This is you know, it's not there. And closing mosques happened during the history many times, actually. Not really many, but at least I know, you know, three of them, you know, three events that this was happened in Baghdad in 656. This was happened in 1215 in Egypt and some other areas, and this was and so there are some other cases of that mentioned by some Muslim historians, including Ibn Hajar al-Asqalani, al-Jabarti, Abdul Rahman al-Jabarti, and, you know, and some other historians. For example, now, you know, even Sheikh Hassan al-Attar in 1215, he said that, you know, I stayed like more than 30 days not cutting my heart because there is nobody who can help me with this, you know. So because there was a lot of you know, dhahaya, you know, people who died at that time, and there was a lot of, and even in Mecca, you know, Ibn Hajar al-Asqalani even mentioned that even in Mecca the prayer was stopped for a while, you know. I don't remember the exact date for this.
This was for the plague, because of the plague, or for other reasons?
Because it's different, you know. When I was talking about Baghdad, for example, it was because of the fearness of Mughal, you know, of Tatar,
Mongols, yeah.
Mongols.
Yeah.
And then if we are the others, because of the ta'un, that
the plague,
you know, the plague that was happened many times, you know, because we witnessed a lot, you know, different many plagues during the history, and we have at least key great plague طاعون in the history. The first one was in it was called like طاعون عمواس that you mentioned this. It happened 17th or 18th century, 18th Hijri. And the second one, it was called the Great طاعون. It was in the Western literature, it's called the Black Death. It was happened 748 Hijri.
Yes, this was the 14th century.
Yes.
Yes, the Black Death, the Great,
yeah.
the Great.
And by the way, quarantine came from this, from in this period.
Yes. But what would you say for the people who say وَمَنْ أَظْلَمُ مِمَّنْ مَنَعَ مَسَاجِدَ اللَّهِ أَن يُذْكَرَ فِيهَا اسْمُهُ? These people are the guests of Allah subhanahu wa ta'ala. How come you prevent them from going to the mosque?
This is just based on I already mentioned this, because prayer is not restricted to the mosque even only. This is number one. Number two, that we have عذر here, and we have الأعذار الشرعية, legal excuses that help us to prevent, to do our obligations. Here we are not talking about canceling our religious obligations. This is a very important point. The obligation will remain, and every individual has to perform his or her obligation, but religious obligation. But we are talking about just closing the mosques to prevent the spread of the virus, and to achieve public interest, which is considered by the lawgiver.
Dr. Laith, we don't have any evidence that gatherings in worship houses differ from any other place. We don't have any evidence-based.
Yeah, well, it's really a question of distance.
That's it.
That's it.
Yeah.
How close I am to the person next to me, it's really the chance I will get infected. Whether I am in a mosque or any other location, it really doesn't matter.
Yeah. Dr. Muhammad, do you have any?
Yes, I have. I'm not so happy from the answer that I got, because the question, people sometimes they say we are not happy for this because they want to say I'm loyal to my Islam and I'm loyal to my culture. Yes, you are loyal to your country, and we are all loyal to our religion, and we respect this one, but it's not as low. In history, people who are not living in the cities, they are not responsible to make Friday prayers. When you are traveling, you don't need to have, you can pray, and you have a special thing for your prayers. We didn't stop praying. Everybody will pray at his home, and the people should see very clearly: are we in a normal days, or we in a special events like traveling, or people? If you don't have 40 persons, sometimes you don't make Salat Jum'ah. If you are in far away from the city, you don't make Salat Jum'ah. There's many reasons. Islam make you easy for you not to do what you need to do, and you do it back, even in fasting. So this is one thing. People here, when they answer for their loyalty for the religion, but not because they don't understand that this is a valuable thing. Other second challenge here sometimes, these people, like Zarqa al-Yamama. Zarqa al-Yamama, she can see very far, and she know the problem is coming, and they don't convinced that the problem is coming. 3 days, the people come and kill them, and they killed them. But we were late to understand that. So what we are trying to do, to put all our efforts as scientists, as knowledgeable people. Dr. Haddadi has many modeling. He is now somehow speculating what will happen, or predicting what will happen. It's very accurate because there is a lot of information give us this. But the public doesn't know this, and they should trust the people who can do this thing. The same thing for Mufti. Why the Mufti? You have Quran and you have Sunnah. Why you need Mufti? Because you need Mufti, because you have to read well, and when things are critical, he use all his knowledge to give the right ifta and keep people safe from different debates. And this is what we are trying to do now, to find the best way to people and make them have optics to see far and understand that this is always for the benefits for all the people, humankind, not only Qatar.
Yes. One other point, because the state itself has a moral responsibility to protect the public health. And this is one of the tools that to help the state to preserve public health.
Mandate. It's a mandate for the government to help the people.
And at the same time, you will, people will keep doing performing their obligations. So we will keep the two values here. Each one of us each part will do his moral responsibility and obligation.
And this is temporary. We didn't say this for a long time. It was temporary. We were clear. Abdul Muttalib, when he destroyed Kaaba, he said, I didn't do this for something bad. I did this one to build it again. So sometimes you do things for a good intention, even if it look bad,
It's
but
an
for a good
emergency
intention.
case. Emergency
Yes,
case.
emergency
Yes.
case.
I just have a little comment here because some people said, I've read this, they said plagues happened so many times. We have no evidence that Umar ibn al-Khattab stopped congregational prayers or jama'at or Jum'ah, Friday prayer during the plague. And our scholars did not mention this. And here I come to the point I raised in the beginning. It's about the conception. How do we conceive this plague, the coronavirus? Now, in the past, we thought it's not contagious. So, okay, why are we going to cancel it? Because there is no contagion. Now we know that it is contagious. We have clear evidence. So you cannot use this analogy. You cannot use this qiyas. The other point I had is about at the individual level. This is at the state level. So the country, based on data and statistics, takes a decision. But there are also individual responsibility. These people may come together as neighbors, maybe, or as family, to have also their prayers and to do jama'at or jum'ah even together. I would say that in the fatwas I have seen, most of the time they speak about the legal excuse represented in fear. Al-khawf, especially al-khawf min al-halaki ala al-nafs. When I'm afraid that my life or parts of my body will be at risk. The examples that Dr. Mu'taz mentioned. People are afraid from conquests. Militants are coming, so I may be killed. So then I don't have to go. I'm relieved from this. But if we take the bioethical discourse, the harm is also not an excuse, but it becomes an obligation not to go. So you say that if I'm infected, I can infect up to 2 and 3, and this will be chained. So each of these 2, 3 will be infected, etc. So I would say if I am infected, I shouldn't go. Not that I have the exception not to go. No, you shouldn't go. Even this has not to do with the state level. So you have to isolate yourself because this can be harming the others. And then we have differences between the people, self-inflicted harm. You mentioned differences between the mortality. So people who have comorbidity, so they have like hypertension, they have heart diseases, they have cancer, they have immunity problems. These people shouldn't mix, even if they are not infected. So these people have also a specific category. So there are different nuances at the individual level, outside also the state issue. I think these were the 3 main questions. We don't have other polls. Am I right? Can I go now to the questions? Do we have other questions? No. Okay. So first of all, do you have questions for each other based on what you heard?
Dr. Laith, people should know your modeling about if you don't make intervention, how is this worse and how much is this accurate? Because people are saying that we are overdoing things. Yes. But the science is telling us, as Dr. Laith has mentioned, that it is a valuable thing to intervene in draconian measures. You need to go sometimes strict, Some people will complain about this, but it is for the society. Yeah. So if you can tell us more how it's...
Just let me add a little bit to make it also fitting within our discussions in religious ethics. You are making the modeling to foresee and expect. So it didn't happen, but it can happen or it will happen based on modeling. We have a trend in the fiqh, in Islamic law, that we judge when things happen. As long as they didn't happen, they call this al-ara'aytiyun, the hypothesizers. Suppose that this happened and then we act. No, we act when things happen. We need to change this mindset, or at least address it, by saying that based on these modelings, we are not astrologers. We are using also science to think about it. And we have the example of Italy, when the government said to them, isolate yourselves, minimize your social contact, Italians went to drink cappuccino. They enjoyed their life as they usually do, and now they cannot even leave the house. So if they acted as they act now 2 weeks before, it wouldn't have been what it is like. So we need also to frame it this way, that these modelings can help saving lives.
Oh, absolutely. And to begin with, these models are not actually coming from vacuum. These models actually were invented because they were very effective in predicting other infections of the past. So how we came up with these models is for all respiratory infections, we know actually how they are transmitted. We build these models, we compare them to the data, backwards, retrospectively, and they worked extremely well. So this is why
they are not hypothesizes, they are based on reality also.
They are actually based on reality, and this reality is not only also retrospective. Let's say there are lots of models who modeled the Spanish flu, the great pandemic 1 century ago, and they did very well. But using these same tools, they actually made predictions for H1N1, which came later, and eventually the predictions actually were close to reality. It may not be perfect because each new infection has its own properties which may not know exactly, But with the H1N1, to a large extent, actually it worked very well. Eventually 50% of children actually got H1N1 and about 25% of adults. So it's very, very large actually epidemic which actually happened. So these models are not really hypotheses or something. They are models coming from reality that we are using based on experience of decades. Scientists have worked to perfect them, to refine them, and so on, leading to this point. Now, one of the great value of the models is exactly what Dr. Muhammad was saying, is actually to model interventions. If I actually do this intervention, how many infections I will avoid, how many actually deaths I will avoid, how many hospitalizations I will avoid. In fact, why we are doing this modeling right now, we are trying to predict how many, let's say, people will need ICU in the next 3 weeks. This is a very, very practical question, because the healthcare system needs to prepare themselves. Are they going to expect 100 cases, 1,000 cases, 2,000 cases? So they are actually very integral part of how we actually respond to the epidemic. And with modeling these interventions, now we know things very, very clear. I can tell you something very easy from the model. If everyone reduce their contacts, as we were saying, by a minimum of 60%, with all likelihood, the pandemic will actually die on its own. The real challenge is that...
Just a second.
Yeah.
This, if it happens at the national level or at the global level?
I'm saying at the average for the population. So if
wherever we are
in any community, if they actually reduce their effective contact rate by 60% at a minimum, with all likelihood, actually the epidemic will actually die out. This is a very, very simple, result, But of course, it's very difficult for people to change, It's very. We know. In fact, we have lots of research in public health which shows it's so difficult for people to change their behavior.
Staying at home is not easy.
Yes, no, absolutely. It's actually not easy.
It's clear now. Health is a condition of freedom.
Yes. Do you have any questions for the speakers?
Actually, it's not exactly related to the coronavirus, but back to the issue of actually vaccine. Some of the issues, for example, we encountered in more recent years. Let's say there are some religious minorities who may have, prohibitions against that, or like some in the United States, there were actually small Jewish, very conservative, Jewish population who actually refused to vaccinate against measles. Now, measles, the herd immunity for it, it's really, we need to have extremely high coverage, almost 99%, to protect everyone. How we are going to deal with things like this, protecting religious minorities, cultural groups, etc. Another, in fact, big question for vaccine came with another vaccine, a human papillomavirus vaccine. This vaccine is wonderful. It's actually almost 100% protect against human papillomavirus, which is a sexually transmitted infection. But and this virus actually causes cervical cancer, which is the second leading cancer among women in the world. So now we have now in our disposal a wonderful intervention, a vaccine. We can give it to people, and it will protect these women from actually having cervical cancer. Now we had some people push back against this. They are having trouble with the concept of having a vaccine against a sexually transmitted infection. If we give it to people, will this encourage people to change their sexual behavior, for example? So I think these are very difficult moral questions, and I would love actually to have some input.
Shall I say one about the vaccination? Because we have an actual case of some Muslims in Nigeria who refused to vaccinate their children for polio. And this led to about 300 children who got it. And a question was sent to the International Islamic Academy based in Jeddah. And they had a session about this issue, and they issued the fatwa about this issue. And they said clearly that the parents who decided this committed the sin, because they put the health and to a certain extent even the life of these children at risk. The muftis who gave their opinions, they also have a moral responsibility about what happened. I spoke about this issue in details in my book on Islam and disability. There is like a chapter discussing this issue, anti-vaccination movement, etc. And the mainstream position among contemporary religious scholars is quite strong. As long as the benefits calculated in the way that you mentioned, the benefits of the vaccination outweigh the possible harms, and from what I have read, there is hardly any harm, but anyhow, if it outweighs the harms, then there is no problem whatsoever. This is about the issue of the vaccine.
And this is by the medical principle. In any intervention, it's always outweighing the benefit. Yeah, so it's exactly what we have in public health.
Yes, the health risk assessment, the health risk assessment principle. Yes.
By the way, I was in Italy a few months ago, and there is a very strong anti-vaccination movement in Italy, and people, avoid giving their children vaccines. So I have no idea if this will affect their immunity or not. So with what's happening, this is not just a new. It's been for a few years. I don't know exactly when it started.
Yes.
I'd like to mention about vaccination. The challenge that few cases in Nigeria, a few cases in Pakistan and Afghanistan. These are the countries that they have still polio. For a few cases, because they are refusing, maybe all of them are maybe 1 million who are refusing to be vaccinated. They are making the world cost billions to keep using vaccinating people for polio, while we can eradicate it and take every year billions to help poverty in the world. So these people, it's part of ignorance, not part of religion, because ignorance, some people are living till now the same way that 2,000-3,000 years ago in some places in the world, while knowledge and light and wisdom make people go to the future and make humankind be proud of itself, how it grows since the dawn of humankind. So we want to push this ignorance away and keep the world safe from using money for something that we can protect the world from.
This is an important point, that the harm here is not that not only that the children will have the polio, but the economic harm.
We are all paying every year and every person in the world is vaccinated for polio because these people are still having the disease.
Okay, I have a couple of questions from the audience. So if we can go through them. There are, I think, some quick questions. Can the vaccination happen through ears? The infection happen through ears?
I'm not aware. I mean, usually the main things are eyes, nose, mouth, and so on. And probably the most dangerous is nose, because we know actually the virus starts infection nose, then it goes to the throat. This is why many people have sore throat, and then it goes to the lungs. So ears, I'm probably unlikely.
Better,
You
it
know.
is
Very
have
unlikely.
protected, have
Yeah.
better
Okay.
materials.
Do we have a specific? Do we need a specific amount of alcohol content sanitizers to make it effective?
As long as it really covers the hand, you know, and well, that's good enough. And also, by the way, not only alcohol.
The percentage of alcohol should be above 60, 70. The alcohol percentage inside should be 60, 70%.
Okay, but then soap also is possible.
Yes.
Excellent.
But it kills the virus.
Okay.
But it's something I like that people said when I was in 1980. I thought in 2020 I'll learn how to drive a flying cars.
Yes.
But now I'm learning how to wash my hands.
Exactly. Someone asks, there are some cases, it seems, of people who got it again after they recovered. So they tested positive. How can we deal with this issue?
It's really generally we had indeed these few cases, and really interpretation. It's most likely it's a measurement issue, or that the people did not really actually recover completely. I mean,
Exactly.
Yeah.
So we don't have strong evidence that people who recover get sick again.
Yeah.
Yes,
We don't have.
yes, and this is something of the not very good message, not healthy message for the people, because when you go for 99, you have prevention for 1 year. And some say no, you can get it recurrence. People keep people down and spread fear, and there is no hope for what we are doing.
You remain concerned.
And this is unhealthy, you know. I mean, for the community.
So the general rule is that those who recover
immunity for 1 year.
At least 1 year.
And this maybe more. Even if he gets it again, he will have some immunity and he'll protect himself for longer time. So he'll not easily die from it.
So it's not the idea that if you recover and then it comes back, then it will kill you.
Yeah, 90% that the system remember it, the memory, memory cells, they understand, and he can be handling it, except if he's this time become immune suppressed.
No, the circulating idea is that it will kill the person if it comes back again.
No, because the system become more smart. You know, if somebody
social media information.
you learn more from the after the surprise. There's no more surprises for the body. Immunity.
Okay.
Yeah,
That's good.
All evidence we have is that actually people have sterilizing immunity, which means 100% immunity after actually infection, but we don't know for how long it will last.
Okay.
But it's very unlikely.
Do we have mutations in the virus now?
So far, actually, hundreds of strains have been sequenced to see the genetic code from different locations, and they agree with 99.9% so far.
So we don't have big mutations.
No evidence so far for any mutation.
Okay. Yes. Will it repeat every season like the normal influenza?
It will be here and there. We cannot say it will finish. But as I said, the herd immunity, people get the experience of it. It will help them a lot to be maybe more prepared for it. But it will not be finished. It will be there somehow. But let's hope, because this is different than SARS. It's more spreading. So it will keep having some focal points here and there around the world. And we are not sure that it will go forever. But people will be more maybe immune for it, and the herd immunity will help them in the long term.
Another question. Can the virus survive high temperatures above 30 degrees, for instance?
It's still debating. We are waiting for the summer. المية تكذب الغطاس. We will wait for the summer and we will see. We are waiting for the summer to test it.
I mean, and it's already actually spreading in places which are quite actually high temperature. I mean, already in Africa, actually, we have also evidence of transmission.
But not as aggressive as China.
Correct.
You know, we are hoping that it's become more like, I don't know, wind or something. You know, Singapore didn't have any deaths.
And in history, did we have viruses that survive high temperature? Or usually the virus would die?
Well, it's not, I'm not sure if it's a question of temperature as much as we know for influenza at least, which is well understood. Influenza like cold weather, cold temperature, and also dryness. So humidity doesn't work very well with actually transmission for influenza, and temperature, the higher it is, the worse it is for transmission. But it really likes the cold weather, you know. So we think probably coronavirus is the same because it's transmitted in similar way.
Okay. This is a question for Dr. Muhammad. Can anyone be tested here in Qatar?
Yeah, if you need to be
even
tested.
if they are not showing symptoms, they said.
Yes, okay. There's protocols who should be tested and who should be not be tested. The tests are not by millions. Everybody can enjoy it. You know,
Yes, we are 3 million. Can we have 3 million tests?
No, nobody have it in the world. Maybe now we are competing. We are the second or the third highest country in testing people.
Yes.
So this was we have more
we are
cases.
about now like 9,000, 8,000?
Yeah, we are around 8,000. So per million, we are 2,500. All Korea is in front of us, and I think we are maybe debatable Bahrain if they tested all the people who are pregnant from Iran, but we are going forward to be number one if we keep this momentum in the coming months. We are planning to have 100 tests maybe, but you cannot give it to everyone because people are always worried. Say, test me again. I think you are negative. Say, okay, after you can test me again, please. I think now I got it. And to never finish the dilemma. You need to balance how to do it and get definition and to assure that they have the proper criteria to be tested. It can be you can be having symptoms tested, you can not have the symptoms tested, but there's a criteria, different criteria to use this test in a smart way and a valuable way.
Yeah. And does it take time before we know
yes,
the
the
results?
challenge that this was a challenge that the first test took us 3 to 4 hours to do, so you cannot release it before 8 hours. Now we're hoping to have a new equipment, this automated system, 2,000 tests we can do in a day, and this will be faster, 90 minutes, but of course 90 minutes plus, you know, taking and send it and bring it back. But at least you will be released in a few hours from your worries.
But anyhow, in the same day, we can get
the
results.
Inshallah. Now we are a little bit jammed because our active surveillance was very high in some areas. But inshallah, we are balancing it, that everybody have priority and he will not be waiting more than 24 hours, inshallah.
And it can be tested even the person is asymptomatic?
For some people, those close contacts. Let's say I have a symptom like a father. I will
so when in the family, so we will test the family.
Yes, but not all his neighbors who came high.
I mean
you start by close.
Living
if you have
in the same
some,
house.
as Dr. Laith said, if the family doesn't have it, I will not go for a second neighbor and tell him maybe you have it. You know, you go by the logic plan. If you have, you grow more till it stops. If it doesn't grow, you don't go to the second level.
Okay. Having a small population here in Qatar, would this help spread the disease, or is it the opposite? Having small population.
Yeah.
For an infectious disease like this.
The challenge that we are not we are a small country, but we are bigger than any city. Maybe even in Europe, most of the cities other than the big 5 cities, we are bigger. We are 2.7 million in a small area. We are not a vast land like Canada or Mongolia. People are living in different places. Maybe they will not get the disease. So in any taking of the disease, it will be in the heart of our city. Our people who grow, everybody goes to the same mall, everybody goes to the same areas in Corniche or Katara. So the risk there that we need to assure that it doesn't strike in the heart of the country, and we should be very alert and look forward that the awareness can spread easy in our country because of the technology and the internet, and the people are visiting each other. So we hope that knowledge will help us a lot in small country to understand and protect ourselves.
There is here the WHO Special Envoy on COVID-19 asks, how can COVID-19 readiness and response best enhanced in Islamic contexts? A very general one.
Sorry, again, I lost.
How can COVID-19, this is the coronavirus, this is the disease resulting from the coronavirus, how can COVID-19 readiness and response best be enhanced in Islamic contexts? This is what we have been talking about.
Yes, to reduce
2 hours now.
Yes, to reduce exactly what we discussed. You know, now I think this was the right action that was made to reduce the social contact and to keep social distance. But it depends on the individual choices now, because still we are talking about isolation, volunteer isolation, you know. But people, I hope that will not go far than this if people will not listen to and will not take this seriously.
And in Quran, وَأَرْسَلْنَاكَ إِلَّا رَحْمَةً لِلْعَالَمِينَ. So it's very clear that you get with the mercy in Islam, that to be tough and rough, you should be more in mercifulness.
I would, yes.
Just possibly the reason for the question also, it's just, I mean, the Islamic response. I think for us as Muslims, maybe we need to stress that this is actually our responsibility religiously to actually to confront actually the epidemic and to act actually accordingly.
Yes.
It's not really, I mean, it's really a religious obligation before anything.
No harm and no harming, you know.
Yes, it is the principle of harm. It is the harm-related principles. If we want to sum up and encapsulate the whole issue, it's about the harm. We agree in Islam with the global bioethical discourse about harming others is categorically prohibited. Harming others, you don't have liberty to harm others. So if your behavior will harm others, your freedom ends. But in Islam, we go further than this by saying self-inflicted harm is also a moral responsibility. And if we will not be punished or disciplined by the state, will be held accountable in front of God. Yeah. So this is a religious moral responsibility.
Preserving life is one of the 5
yes.
objectives of the Sharia, you know.
Yes.
So preserving life is just it's not just my life, and you know, life in general, life of the others, you know, and taking care of other people even, you know.
Yes. So I hope this is clear. We have a question about diet. To what extent does diet play a role in reducing the chances of infection? There is a lot of misinformation being spread lately regarding certain foods that reduce spreading. Is there any concrete research backing this?
I'm not aware of
some people are circulating now garlic, and in some countries garlic is getting really sky, the prices.
Well, maybe garlic.
Do we have any evidence?
Social distancing, you know.
But immunity, like usually the immunity go with vitamin C. You know, vitamin C is different types of fruit or health. Vitamin C can help lowering sugar. You don't find a lot of sugar in the blood to start aggressively growth of the viral. So lowering sugar, fruits, vitamin C, honey somehow, this can support the immunity.
Okay. Another question. Why do we have big discrepancies between countries in the number of deaths? Like Italy, Iran, China, while the others are not that bad.
Okay. Yeah, very good question. It's too early to over-interpret actually the death and mortality. And for example, for China, now the mortality is about 4%, but they are towards the end of the epidemic. This is really what's the final one. However, if we go to another country, you know, let's say Korea, they have actually very low mortality rate. Possibly, maybe because they were more prepared for in their healthcare. But another reason is we know actually from the data, people take on average, take between 2 to 8 weeks before they are sick enough to actually die. A lot of infections in the world are very recent. We haven't yet seen actually the worst deaths, by the way. Because really we still need, it will take several weeks before we know the toll on mortality. Another issue also relates, differences between countries is actually to testing. For example, a country like Korea, they did incredibly well with testing, just like what Dr. Muhammad was saying. They are doing 20,000 tests every day, and very smart focused testing through contact tracing and so on. So they were able to find basically essentially all infections. In Iran, however, really it took them a while before they increased their testing. So what they were really seeing is only the most severe cases. This is why their mortality rate seems to be extremely high, just because all the mild infections were not actually diagnosed to begin with.
Okay. There is one question about I'm the caregiver for both my parents who are old and hospitalized. Shouldn't these people work from home to reduce the risk?
Sorry, the family is in the hospital or at home?
It says that I am the caregiver of both my parents who are old and hospitalized.
Okay.
Shouldn't these people, I think he means or she means old people in general, shouldn't be work?
It should be evaluated because they are old enough that maybe staying at home is not doable for them. They need some special equipment in the hospital. The hospitals are working on a high protocol to keep these areas especially protected, the immunosuppressed, cancer, and the elderly, to keep them very protected with high infection control measures in the hospital. Maybe they go to home and they don't have these infection measures and be at risk again. So it should be evaluated properly for the age of his family to know how much is risk to stay at home or at hospital.
Okay. One says that a recent Lancet journal article hypothesizes that ACE2 stimulating medication increases susceptibility to the virus. Could this explain why people with CHD hypertension, diabetes, and anti-inflammatory disorders have higher morbidity and mortality from COVID-19?
Yeah, good question. I'm not aware of the study to be able actually to judge. Yeah.
Okay. Is there a possibility for conspiracy theory that this virus has been invented by someone?
Extremely unlikely.
Okay.
I mean, this is something that did not happen once or twice. It actually happens, by the way, on daily basis. Infections from our ecology enter into human circulation. But of course, the vast majority of these infections don't spread. Usually, they don't actually spread from one person. There is no human-to-human transmission. So they die actually quickly. We never know about them and so on. Here, in this specific case, by the way, I mean, we have very, very good evidence. Clearly, it's almost certainly the epidemic started in a wildlife market in China, where they are selling wild animals,
Not because of eating them?
Mixing them, They put the best, they put other things. They have the pangolin. They find it 99% pangolin. I don't know how much they eat the pangolin, but they put them above each other, so they contaminate from each other.
Okay.
So one of the spread between the animals, different animals. In normal life, they will not be connected because they are different types. But in this special situation, they are connected in the cages, and the disease becomes stronger.
One of them, and
this is the other debate that the aggressive start virus in China was aggressive, killing more people. I mean, the 4% of China is after they mitigated a lot of things, but it was higher. It can be like SARS, 10%. But the other part of the world, will start coming from human to human, it's become a little bit more benign than what we saw a starting point in Wuhan.
Okay. Dr. Mu'taz, someone asks that the adiyya, the supplications that we can have, like Bismillah alladhi la yadurru ma'a ismihi shay'un fil ardi wala fis samaa'i, etc. Would this be enough without worrying about the medicine and stuff like this?
Of course, after this very long discussion.
Yes. I would just add the issue of divine agency and natural laws. So if you supplicate God and you direct yourself to God, you have to respect the laws that this God also created.
Exactly.
Out of respecting the God that you believe in.
I believe dua will help.
Yes.
Dua will help. It will give you some morals. You put you in a better moral. The spirit, the universe energy will help you. But you should go with the same belief. You believe in this God, go with all his other advices or guidance, so you can be protected properly.
Yes. Finally, if you have any last message, take-home message to the people.
For my message, I would like to share that we are very proud in the Islamic world. They have a lot of scientists and doctors and healthcare that they know their religion and their values, and they learn properly, like all the international knowledge, and they're trying to merge it properly to keep the values of Islam, but to help the community to grow in the right direction and to be leader in the world international and support others. So please, the people, help us to assure that we give this community a chance to prosper and go to the old days of Islamic pride about helping the world and supporting them in humankind.
Thank you. Dr. Layth?
Yeah, it's actually quite similar message, but just phrase it slightly. This pandemic will go away sooner or later, inshallah. But we can make it actually go sooner than later by everyone really, by voting a lot of value on individual responsibility to please everyone follow the instructions that have been told and communicated to them. Much more social distancing, much more washing. Also, anyone with symptoms, please isolate yourself immediately at home, and you can call the hotline, and then they will tell you what to do. Yeah, but please don't go and mix with if you are actually having symptoms, and then we will go through it, inshallah.
Dr. Mu'taz?
So my message is that everybody should take his moral responsibility or her moral responsibility, and our Muslim scholars usually talk about some etiquette, some adab in this in the epidemic context. So they should keep take care of dua even at the same time, but it's not either or. So beside the taking the instructions from doctors. And let's be close to Allah and then do our religious obligations individually. It's not a holiday now from because we closed if the mosque were closed. It doesn't mean that to get out of our religious obligations and worship.
Yes, I will also conclude with a little message, which I have been busy with the last couple of days through this panic, that it shows that we are still vulnerable. Despite all the progress that we have done, we are still humans. Humans are characterized by weaknesses. We have our own limits for our human agency. And at the times of crisis, from an Islamic perspective, it's always a learning moment to sit back and think about what we have been doing. A time for muhasaba, for revising our deeds. I think at the global level, we are not doing well. We are not in the best moment in history. I think we agree on that. The damage we are doing to the climate is a very bad thing. We need to rethink about this. I think one of the main benefits of coronavirus, if there are any, is that we are reducing the dioxide carbon. We are traveling much less than we used to, and people were traveling for luxurious issues, not just for essential issues. We need to rethink about this and how we can redefine our and reshuffle our lifestyle. The other thing is that values are important. At least the very simple hygienic values are quite important. And in Islam, any book on fiqh begins with the chapter on tahara, cleanliness, that we have to keep ourselves clean and we have to do this. So it seems that sacrificing our values can also have negative impact on our health. We thank you very much, everybody watching us, and thank you very much, all of you. And hopefully, inshallah, we will have other events to be together. Thank you very much. Assalamu alaikum, everybody.
Assalamu alaikum.